Here we go anyway. Okay, so actually there's some interesting stories that are coming out this week that I think we should absolutely be watching. The first actually comes out of California. It's the first US court that has put in the statement that fluoride in water may be risky and it must be addressed. This was a case that was being heard in the US District Court for Northern District of California. The judge has deferred the decision actually back to the EPA to say that this warrants further investigation after hearing both sides of the story. And he's looking at the Toxic Substances Control Act and trying to make a determination. He did not feel it was within his jurisdiction to be able to do so, but he didn't rule against it either. And he said that there is a potential of an unreasonable risk of injury. And so he has sent it back to the EPA for further investigation. So that does mean that the EPA will now be picking up water fluoridation, which I think for most of our careers thus far, we've taken that particular community activity for granted. We've seen a few upticks of communities wanting to vote to pull it out of the water system for a variety of reasons. But now, because it's been in a U.S. district court, that will move it up the food chain in the federal system and certainly will activate federal regulatory agencies to take a peek at this as well. And to ultimately go back now and review guidelines, review the science and data to ultimately determine whether or not they're going to keep fluoridation in the water system. And if they do, is the 0.7 mgs per liter the really safe level, or should we be looking to lower that level down even further? I do think you could argue the fact that now being in fluoridated water systems for a very long time, multiple decades now, there is definitely a trickle-down effect of where you're getting access to fluoride through purchased water supplies that you're getting at the store, also your municipal water supply, and what's the compounding effect of all of those things. So, I'm sure the EPA is going to be looking at all of that and ultimately making a decision. But I think this is the first time it's actually moving out of these small municipalities that are having these discussions and now being revisited by the federal government. So we'll stay tuned to that. Another interesting story coming out of the legislature is that there is a House bill that's just been introduced to expand access to care through the Medicare program. We've seen an uptick in activity and a strong push to want to get dental care benefits included in many of the Medicare programs that are out there. But this is probably got the most steam, and certainly because it's an election year, I think they're trying to put a lot of things before the House and Senate for votes, maybe before a changeover in November, or certainly will be a changeover in presidency since we don't have an incumbent running. And so I think to hedge those bets and knowing who's going to be currently in office for the next 8 weeks or so, actually less than that, 4 weeks now, to see if they can get a few things put before and get it moving before that change occurs. So we're seeing the Comprehensive Dental Care Reform Act of 2024. And that is an act to push more dental benefits in Medicare for those individuals that are over 65, lower income Americans, and veterans. If it's passed, it will become an essential health benefit under the Affordable Care Act, which means it will open up the door for more reimbursement for dental care services for those populations that were identified as in need of dental care. Now, there's a lot of back and forth about whether or not this is a good idea. Can we afford it or not? So I think we're going to see a lot of vetting of that particular program to decide if this is going to pass the muster of whether or not this is something that the government can actually afford to implement. But you're seeing a lot of momentum now wanting to look at including dental care benefit. This is one of like 5 or 6 bills now that have been introduced trying to get dental care benefits included in Medicare. So there seems to be a lot of momentum moving in this particular direction. So we will look at how both the Senate and the House are looking at the bills to determine what they will do next for dental benefit and what that will mean for us on the ground as we help support those patients. The last little bit of news for this evening. We always have to have a little bit of fun because I've been accused on occasion of having very sad news. And look, again, there were plenty of stories of a dental assistant who was running an illegal dental practice in a bedroom in her house. Another doctor is just suspended for infection control violations out of Washington State. And now they've had to issue, excuse me, I'm going to make sure that's correct. I might have misspoken. But that particular story, he's now, there's an alert out to all these patients for potential bloodborne pathogen spread. So there's all these fun stories that we could be highlighting, and yet we're not doing that. We're going to focus in on a little fluff on this Wednesday before a hurricane and lots of water on the East Coast. An interesting story came out highlighting where patients spend the most money on a routine visit at a dental office. Now, I was thinking we could have a little banter with the guys on this particular activity if they might want to rejoin me back onto the program. Maybe.
I'm quicker on the trigger than Chad is.
Why am I not surprised?
Yeah.
Okay, boys. First guess, and don't look it up. Where do you think the most expensive dental cleaning and exam, just a dental cleaning and exam and x-rays? Where is it coming out of? What state?
What state?
Yep.
Florida.
Okay.
I'm gonna say whatever state Nantucket is. Massachusetts. Yeah.
That's not a bad guess.
Okay. It's North Dakota.
What?
And here's the crazy thing about this study.
Bisons.
That was actually my 49th choice.
Yeah, I know. It was going to be my 50th. Here's the crazy thing. This whole study is the inverse of what you would think. The most expensive dental exams in the U.S. currently are coming out of North Dakota. They're coming out of Montana, Missouri, Oklahoma, and then, of course, Texas. And I'm sure actually most of that data came out of Chad's office. Because that
Well,
shit.
I would say,
am I right?
in Missouri and Oklahoma, the problem is that they're charging more to clean gums because there's less teeth.
For sure. For sure.
Yeah.
I'm sorry for all those people in Oklahoma that Chad has just shunned completely. On the inverse side, the least expensive state to receive a dental cleaning and x-ray set is in New Hampshire. That's right, guys. It's the total inverse of what you would think, right? Cost of living traditionally on the East Coast is higher. The cost of everything on the East Coast and, far West Coast does tend to be higher than the middle states. And yet the middle states are getting the most bang for their buck when they walk into the operatory. In fact, I'm a little jealous reading this story. So New Hampshire is 24% below the U.S. average at $153, while North Dakota is raking in an average of $263 per dental cleaning and x-rays.
So I would venture to say that this is based upon the number of dentists per population.
I think you're right. I think there's definitely something to be said about that, but you could also argue that competition has forced costs down.
Yeah, I think a lot of it has to do with the amount of managed care that's being offered.
I would also say that California, New Hampshire, New York, New Jersey would be lower on average because of the number of dentists and the amount of people who participate in insurance.
Do you think there's fewer people that participate in insurance in California, New York, New Jersey?
No. I'm saying that because there's more people that participate in insurance, that the costs are lower.
Right.
100%.
So
100%. And again, it goes back to the competition. Because
I would say California is probably towards the bottom of the list, and you'd want to say that. I mean, you would want to say that Beverly Hills would probably be the highest. And I'm not knocking any state. I mean, I did joke about that.
Nobody's taking this,
but it all sucks. I mean, we're in a very competitive environment, and insurance is screwing us all. Sorry, said it.
Well, on that positive note, good discussion,
you know what,
though. Like I never would have guessed Montana. I mean, I never would have guessed North Dakota
or North Dakota. Come on.
Yeah, well, I
Montana
mean,
maybe because so many people from California have moved out there, but I really wasn't thinking North Dakota. Anyway,
I also read recently, I mean, I know this is way going down a rabbit hole, but I also read recently that Montana is one of the most expensive places to live.